Executive Vice Chairman at Narayana Health. Thank you so much for being live with us today. So 4,000 plus cases. Very, 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 very small given our population. But what we've learned from the first 3 waves is we know how fast this can spread. So we must mask up. We must take our booster shots. We cannot afford to take our eyes off vaccination. For Viren Shetty, when it comes to preparations, the early signs seem to be hospitalizations, not a concern, but you tell us, how are you preparing if there is going to be any new wave at all?
Well, to the extent that you can make the precautions and people mask up, that's as much as we can do at this point. Hospitalizations are very low. There are examples from the Western countries, and our colleagues over there have told us that even though there's been a rapid spread of new variants in Western Europe and the United States, the accompanied number of people that are getting hospitalized are not comparable to what it was in prior waves. So from that perspective, it's not something that we are overtly concerned about, but definitely we are concerned because all our hospitals are full right now. So just to give you an example, last night I got a 1 o'clock call for someone wanting a bed in Bombay. Now, I hadn't gotten those in a lot of months, and this being the first, hopefully it doesn't continue. But why they were not able to get a bed is because hospitals are full. So there's been so much backlog across all our facilities. There are a lot of people who are coming in for cancer, for cardiac treatment, for also the treatment that they've been postponing this entire time. So the older, more serious people who may need to get admitted, admittedly, while there being very few, will still find it very difficult. So to that extent, we'll start making accommodations in ICUs across all our hospitals. But still, I would say from a large numbers perspective, it's not something to be overly concerned right now. As the facts change, then of course we will change our strategy.
Morning, apologies to keep you waiting. Things were a little awry this Monday morning. But tell me, you think detection would be a little more difficult this time around because one is hearing in the wave, which is here in Mumbai right now, that the symptoms are not just upper respiratory, but even gastro issues. And then that's leading to detection of the virus.
Yeah. But see, we operate in a very small universe, that is people who are sick enough to require intensive medication, oxygen, and so on. So as far as the symptoms that can be managed at home, they should be managed at home. Then there are plenty of treatments that people have available to them and plenty of ways in which they can be diagnosed online without having to take up hospital capacity. So yes, COVID does display multiple symptoms, of which headache, fever, gastro issues are among the ones that are quite common. But all of these are quite manageable at home. But if you are older, if you are sicker, then yes, there is hospital capacity that will be kept available.
Sure. Outside of COVID, Viren, help us understand what really is happening with volumes per se with, Narayana Health right now. Because as I understand, we had seen a bit of a sequential dip in the volumes for your India operations. What's the visibility now going forward now with the irritant that may turn out to be a 4th wave? Who knows? I mean, these are still early numbers.
Yeah. So the irritant was the Q4, which included January. And January, of course, was the first Omicron wave, which required there were a lot of lockdowns, there were a lot of people that were scared to come to hospitals, and that led to the dip in numbers. But since then, I mean, it had a rapid recovery in February, March, April. Last 3 months, we've been going more or less continuously full across all our capacities. And in fact, we're adding much more capacity in OTs, ICUs, cath labs, diagnostic facilities, because people have been postponing cases. And now I think people are becoming a lot more aware about getting frequent scans done, getting their checkups done, and just being more aware about their overall health, which is turning up a lot of issues that would have otherwise gone undetected and undiagnosed. Because here's the simple thing. As a population, Indians are the most undertreated, underdiagnosed, under-medicated population in any part of the world. There's just so many things that are wrong with us. If you start looking for it, you're bound to find that out. And of course, since it's better to focus on prevention rather than cure, the earlier you're able to detect these symptoms, the easier it will be for hospitals to be able to treat you. So we would say that barring any sort of mass COVID wave similar to the Delta or the Omicron, I don't imagine things to really dip from the number of people visiting hospitals in the future.
Hi there, good morning. Given the fact that I ask this because a lot of corporates that we interact with are alluding to the fact that the rising inflationary pressures are playing havoc when it comes to their overall operations, what about for your sector or your hospitals in particular? Are there any major expenses when it comes to operational staff, machinery, etc., that is impacting numbers?
Yeah. It's not anything new for us. You see, nearly all our advanced medical equipment is dollar denominated. So we've been facing rupee devaluation, therefore cost inflation on that for decades. A lot of the input costs for us are on very scarce manpower, doctors, nurses that we simply don't produce enough of. And so we've had manpower inflation for years and years. So while this may be coming as a complete shock to the tech sector, the manufacturing and so on, who are used to years and years of stable prices, it's something that we in the healthcare sector have learned how to deal with. And the way in which we deal with that is through a combination of focusing on certain cost efficiencies, trying to do more with less, bringing in process efficiencies, and certain price increases that you have to take from time to time. So it's not something that we would have necessarily planned for, but it's something that was always factored in.
And give us a sense as to what the outlook is on the net debt for the company.
We have a pretty massive CAPEX plan because what's happened, as I indicated earlier, is that all our hospitals are running full. And so we need to expand a lot more in our Bangalore and Calcutta facilities. We'll be adding more beds to our Delhi, Bombay, Raipur facilities. Jaipur, Ahmedabad will be adding oncology. And so while we normally would be borrowing between 150 to 200 crores in CAPEX every year, this year we're looking at closer to 700, 800. Some of it will be managed through accruals, some of it through borrowing. But it's something that is really desperately required for us because we've been holding back for years now.
Shetty, before we let you go, so if the numbers are rising and your hospitals are full, going forward, what is it going to mean then for the COVID business and the non-COVID business? Will you again have to take out sections of your hospital in anticipation of a new wave? And will that then not impact the non-COVID business?
It would. We'd have to treat this more dynamically. Again, we don't expect a situation to occur this time where the entire hospital is emptied of the normal routine cases and it's suddenly replaced with completely COVID beds. It will be something where you will section out portions and create a 5, 10, 15 bed COVID ward. And either it gets filled up, and when it does, we start taking up more rooms. And then naturally, organically, if there's a lot of scare outside, people will stop coming and more beds will get freed up. So it's not easy for us to plan, but we think, and just given the example of what's been happening in the West, it doesn't lead to as many hospitalizations. So hospitals will just learn to have more or less a 90% mix of cases that are in the normal rate of doing things. And as and when COVID patients come with severe symptoms, it just so happens that COVID is one of the things that they have. They may come in with other kinds of cardiac distress, lung disease, gastro issues. And one of the things that would be detected would be COVID among them. So we treat that in the normal course of all their things. And in fact, in insurance companies in the West, they've just started reclassifying COVID as seasonal respiratory disease, which is to say nothing novel. This is just factored in along with SARS, H1N1, all the other respiratory diseases that you deal with. And so we just have to learn to take it like any other disease.
Fair point. So that's what is happening. We have started to see from the stock market's perspective, the diagnostic stocks, the hospital stocks started to stage a comeback. But of course, the issue is far more important to talk about. Ladies and gentlemen, do not let your guard down. Please stay masked. If you haven't got your booster shot done, if you're behind your vaccines, please stay up to date. Please get vaccinated. Viren Shetty, it's always a pleasure talking to you. Thank you so much for joining.